working with each other, regardless of chamber, regardless of party, to get a product which meets that need. And so very honored to have worked with you all. And so let me now introduce Senator Hassan, who on the Senate side, her staff and my staff, I just mentioned Mary Moody on my staff, who really did an incredible job. But she was a great partner in this. Thank you.
Thanks, Bill. Look, I just want to echo my thanks to Senator Cassidy, to all of my colleagues here from the House, for everybody's extraordinary and hard work on this issue. And just to reiterate a little bit, we have heard story after story about these outrageous surprise medical bills. The woman in Seabrook, New Hampshire, who was told on a Sunday morning as she was experiencing symptoms of a heart attack to go to her local ER, which was in her network, only to get a surprise medical bill for about $1,300, I think it was, after she had had all the diagnostics run and told she was okay. When she called her insurance company, having been told to go to that ER, the insurance company said, well, you chose an out-of-network provider. It was one of the docs who read one of the test results who wasn't in network, and she was stuck with a $1,300 bill. That's what we are trying to make sure doesn't happen again, because the whole point of health insurance is to cover necessary health care costs and eliminate surprises. That's why people get insurance. And so we really have to carry this one over the finish line. Patients have waited long enough. We have to end this unfair practice. What we have worked on over the last couple of years is really this ongoing stakeholder and member engagement around the issue. We have a bipartisan House and Senate agreement. It is a fair solution to end surprise medical bills, and it is a fair solution to protect patients. So I look forward to continuing to work over the next few days with my colleagues in both chambers and both parties to make sure that we can get this done and end this practice of surprise medical billing once and for all. So thank you again to all my colleagues, and I think next up is Representative Rowe.
Okay. I'm Donna Shalala. I represent Miami's 27th Congressional District, and I'm just delighted to join my colleagues here. Look, the story is pretty straightforward. We've taken the consumer out of the payment dispute. That's exactly what this bill has done. And I want to say this, that the patient is held harmless. But the story here is also that it's possible for the Congress, both the Senate and the House, both political parties, to work together on a very complex issue. We get credit when the issues are simple and we can reach agreement. This was a complex issue that required a lot of listening and a lot of understanding, and I couldn't be prouder. I'm sorry my colleague Joe Morelli is not here because two freshmen, literally working with our Republican colleagues and with the chairs of and the ranking members of our committees, were able to work with the Senate and produce a bill that helps the American people. No question about it. Every American that walks into an emergency room that gets an operation was at risk of having some out-of-network provider. That is gone once this bill is passed. I'm sure there are technical corrections that need to be made. There always are. Whatever doesn't work, we'll fix a little later on, but what's important is the consumer is protected, and we have demonstrated that we can take something very complex and produce a bicameral, bipartisan solution, and I'm just delighted to be here and to have the opportunity to work with Senator Cassidy and Representative Rowe in particular. Thank you.
Thank you, Dr. Rowe, and thank you, Dr. Cassidy, and everyone else here. This has been an incredible effort. You know, all too often we hear these stories, and you'll hear them constantly from the docs that are here and the members of Congress that are represented, about the horrors of receiving a medical bill after you've received emergency care. Look, a mom that takes her son in or their daughter in for a broken wrist, after an athletic accident. She just wants her child taken care of, and she doesn't really care at that moment if the person is in network or out of network. They just want their child to stop hurting, to get fixed, and be able to heal. Well, there's also another issue here that's something that we've addressed in this bill that I think is very important, and that's an honest and true bill on procedures that are scheduled in advance. How many times have you gone in as an American to your hospital or to your doctor's office and asked to see how much something is going to cost? For those that have recently tried to, or in the process of having a child, good luck on trying to find out how much that entire procedure is going to cost you as well. So what we've done on this is try to get to the point where if you schedule a procedure and it's about 3 days out, that you're going to get an honest and true bill. We think that's important. We think that adding transparency to the system, make sure that we get a much cleaner process. It's more fair to the patient. It allows the patient to take their healthcare dollars and to make very good value decisions on their treatments. Most importantly, we think it will drive efficiency in the system, and it's only fair that you know what you're about to pay for and what that cost is going to be. So I want to thank on the Ways and Means Committee, Ranking Member Kevin Brady and Chairman Neal, along with other Doc Caucus member Brad Winstrup, for really pushing this issue forward and standing together on it. And with that, I will turn it over to my colleague from Indiana, Dr. Bucshon.
Good morning, everyone. It's an honor to be here with my fellow Doc Caucus members, as well as Secretary Shalala and others, and the work that they've done. I'm going to shift gears a little bit. I'm Dr. Larry Bucshon, represent the 8th District of Indiana, and I'm going to start a discussion here about E&M codes, evaluation and management codes, and the changes that have been made in a rule from CMS, and why we believe that that this is problematic right now during the pandemic. Look, doctors are the heroes right now, and nurses and other medical people keeping our families safe during these uncertain times. Now they're beginning to help vaccinate our citizens, the most vulnerable, starting first, to move closer to getting us past this pandemic. All doctors should be met with a helping hand from Congress at this time. And that's what this country does for its heroes. Instead, our heroes performing surgeries are preparing for more than a 10% pay cut, and some specialties starting January 1st. For example, people performing life-saving brain surgery are facing 7% cuts. Open heart surgery, which I did for many years, 9% cuts, and there's a long list, which I have here, of other specialties getting ready to be cut. I want to make it clear that cutting any provider pay now as they care for our loved ones is really disheartening and not appropriate. No doctor should have to worry about large pay cuts while they work to get back on their feet as they continue to care for patients and battling COVID-19 on the front lines. Remember, across the country, a lot of hospitals' elective procedures were shut down completely. So in the middle of the pandemic, medical professionals could not practice their specialty. So this would be just another layer of insult on top of that. I'm not saying it wasn't necessary in the areas that it was done, but that's the critical nature of this. Physicians are already struggling to stay in business. I've introduced H.R. 8702, the Holding Providers Harmless for Medicare Cuts during the COVID-19 Act, with Representative Vera, a physician from California, which would hold doctors harmless from these pay cuts while ensuring doctors scheduled to receive the increases would keep their increases. I want to make it very clear that I support the increases to primary care providers. They've been underpaid for decades, really. I do support that. And there are other solutions out there that could mitigate these cuts. So today I'm calling on our leadership to include this fix, as I've outlined in 8702, or another viable fix. I mean, ideally it'd be great to waive budget neutrality on this issue so that we wouldn't be faced with these cuts in the first place, but I know that's a heavy lift. But I'm calling on the leadership of Congress, either in the COVID relief bill or in the omnibus spending bill, to fix this. And finally, I'll just talk a little bit personally about me. I mean, I was 18 when I decided I wanted to be a heart surgeon. I did my first surgery on my own when I was 33 years old. And many of these doctors in this room have a similar story. This isn't just about fair reimbursement. This is about acknowledging the passion that physicians have in this country to take care of people, and physicians who dedicate their lives to caring for their patients. And being a doctor isn't what you do, it's who you are. And at this time during a pandemic, the federal government needs to commit to doctors and providers and show thanks to them for caring and protecting our loved ones each and every day, especially during these challenging times with COVID-19. And with that, I'll yield to Senator Cassidy.
I don't know, you guys go. You guys go.
Thanks, Senator. Dr. Harris.
Yeah, no, thank you very much. I'm here just to address these E&M code cuts. Look, the bottom line is, let's get into the real and practical words. So, when we talk about E&M codes, evaluation and management codes, that's basically office-based practice. So a lot of things we can think of as primary care. And the other thing Medicaid pays physicians for, basically procedural things, the procedure you do. The law as it currently stands, or the rules it currently stands, will increase pay for those things that are office-based, mostly primary care. And because of a budget neutrality requirement passed years ago, before COVID, it's going to cause a cut in pays to specialists. Now, I was in the operating room last month working with urologists. Urologists told me that during COVID, they hurt badly. Obviously, people didn't want to go see the doctors. Their income levels went down. They had to partially lay off some of their staff. And what's going to happen is now, as we get out of COVID, you're going to see a pent-up demand. What does this mean for the Medicare patient? Because this only applies to the Medicare population. What it means is that a physician or a physician group is going to have to make the tough decision to say, I have to limit the number of Medicare patients I see, these specialists, because I had a boss once who said, if you lose money on every case, you can't make up for it on volume. The bottom line is that they will have to limit access of Medicare patients during this resurgence in need for medical care this coming year. This is not the time to cut the pay to specialists. Our Medicare patients depend on specialists. They need specialists. When they need a hip or knee replacement, they don't want to wait a year and a half, because the government has decided to fairly arbitrarily cut the reimbursement that they're going to get, the payments they're going to get. So we need to do the changes. There are a couple of bills out there. Dr. Bucshon mentioned one. Dr. Burgess has another bill. There are a couple of methods we could do to delay or postpone these cuts and continue to take care of our Medicare population. With that, Dr. Joyce.
Thank you, Dr. Harris, and thank you, Senator Cassidy and Dr. Rowe. Thank you for what you've done in bringing us here together. My name is John Joyce. I'm a physician who represents Pennsylvania 13. I am the first dermatologist to be elected to the United States House of Representatives for a full term. As a specialist physician and the only dermatologist in Congress, I understand firsthand what the upcoming Medicare physician fee schedule reimbursement cuts would disproportionately harm doctors who are responsible for important patient care, including skin cancers, screenings, and other vital services. These cuts would be particularly harmful in rural communities like those that I represent in central Pennsylvania, which right now are struggling to keep their doctors. Especially during the COVID-19 pandemic, it would be catastrophic to inflict more financial upheaval on the physicians who are caring for patients right here, right now, as we are speaking. Our nation is facing a growing healthcare crisis. While heeding the coronavirus mitigation orders, our patients are canceling their doctor's appointments. They're skipping critical screenings and procedures. In the months and the years to come, American physicians will be working to combat the ramifications of this delay in care that we are seeing right now. And now, more than ever, it's imperative that doctors have the resources that they need to provide those life-saving care to their patients. Reimbursement cuts clearly are not the answer. In Congress, we cannot wait another day to address this issue. We have a legislative solution that maintains positive updates on E&M services while also ensuring that those providers who are negatively affected by budget neutrality are held harmless. Today, I'm calling on Speaker Pelosi to allow us to vote on this common sense fix and safeguard the much needed patient care. It's time to get this across the finish line. We in the Doctors Caucus have taken the pulse of the patients, and the patients need to have the care that they deserve in America. Thank you for being here with us today, and I yield to my colleague, Dr. Murphy.
Good morning, everyone. I'm Dr. Greg Murphy, and I'm a practicing neurologist and a proud member to represent the 3rd District of North Carolina. I was in the operating room operating on Monday. I was operating yesterday morning. The mood is very somber at our hospital. We've seen, obviously, now we're in a 3rd spike of COVID cases. But I listen to my fellow surgeons, and I hear despair, I hear grief about what the year has given us. But I also hear despair and grief about what the profession is undergoing right now. We went several months because of hospitalizations and elective procedures being pushed up and not able to be done, that this is the bread and butter for keeping surgical practices alive. And they took such a big hit then that they don't know how they're going to continue. Now, to put the budget cuts that are put in now, some 10%, some 12%, some even 13%, on specialists and surgeons will be cataclysmic to their practices. We've looked now and seen that rural America especially has a very big dearth of surgeons. We don't have enough surgeons in so many different fields. So when now this is coming out, and we're going to be cutting the surgeons even more, what this is going to do is this is going to severely affect access for Medicare patients. And these are the ones who need the most surgeries. They're the ones who need most of our health care. If we don't have enough surgeons now, what a lot of surgeons I'm hearing from, my fellow surgeons, are they're saying enough is enough. I can't do this anymore. I can't keep the doors open with Medicare patients. And we will limit access for them, or the doors will close completely. And what are we doing? And what we're doing to our Medicare patients, the most vulnerable, those who count on us to take care of them, will not have surgeons to take care of them. So we're calling on our Speaker, we're calling on our Majority Leader, we're calling on the Senate. We have good legislation put forward to put out the budget neutrality and don't kill the doctors and surgeons who have worked so hard to keep our patients alive. Thank you. I thank you for all the efforts of my colleagues, and I'm hopeful and optimistic that we'll have something fixed by the end of the year. Thank you.
Thank you, Dr. Murphy. I'm going to just wrap up very briefly and with the E&M code cuts. Let me just say this: they cannot happen. It would be catastrophic if they did. I live in rural America. I see the access issues. They're only going to get worse. Both surprise medical billing and the E&M codes are about patient care. They're about the people that we take care of every single day. And I just will say this: if the Congress leaves here and doesn't fix this E&M code in the middle of a pandemic, no one last year could have conceived in January that we were going to be dealing medically with what we're dealing with. And we're telling all of these folks who are going into the hospital every day, putting themselves at risk, the nurses, the doctors, the healthcare providers, putting their families at risk for doing it. Oh, by the way, thank you very much. We're going to cut your payment by 10%. That cannot happen. And so I would implore our leadership, do not leave this Congress, 116, until we fix this problem. I want to thank all my colleagues, as Dr. Shalala said, and others. These are complex issues where people came together in a good faith effort to do the best for both providers, insurance companies, and patients. And I think we've done that. Is it perfect? No. And we would never have a perfect bill, but we have a chance to relook this 1 year after the surprise medical billing goes into effect to see what effects it has had. I want to thank all my colleagues for being here, and if any questions, we'll be glad to take them. Thank you all.
Thank you.